I'm Roger DeRose. At Kessler Foundation, we're committed to changing the lives of people with disabilities through research and employment strategies. And that's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Overcoming eating disorders next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by the Robert Wood Johnson Foundation, Wells Fargo, Berkeley College, PSE&G, committed to improving New Jersey's economy and strengthening its communities. MD Advantage Insurance Company of New Jersey, the Mental Health Association in New Jersey, and by Steve and Elaine Pozicki. Promotional support provided by NJ.com, Small News, Big News, True Jersey, and by Commerce Magazine.
Welcome to Caucus, New Jersey. I'm Steve Adubato. You know, eating disorders affect over 10 million Americans, including many children and adolescents. Here to discuss how to safely and successfully deal with this very serious issue, we have Ani Orphanides, who is a registered dietitian specializing in eating disorders. Lynn, a clinical supervisor of the eating disorder unit at Robert Wood Johnson University Hospital, Somerset. Lauren Moss, a former eating disorder patient. And finally, Dr. Peter Dabrowski, an internist in Mountain Lakes, New Jersey. I want to thank you all for joining us and let you know as you watch this program, you're going to see a couple of very valuable and important websites. One, the Robert Wood Johnson Eating Disorders Program website, and also the National Eating Disorders.org website. Use them. Important subject. And Lynn, how much misinformation and confusion is there about what eating disorders really are and what they're not?
I think there's a lot of confusion out there. I think that people, when they think about eating disorders, they think of this a young female who is looking very emaciated. And I don't think people realize that eating disorders come in really all shapes, sizes, and ages. And many times someone could be suffering from an eating disorder and look like they're a normal body weight. So I think that there's a lot of confusion about the stereotypes that are out there.
Let's try to break a couple eating disorders down, because this big category called eating disorders. But there's bulimia, which is not exactly anorexia, and not binge eating. Can we go through a few of them? Bulimia is?
Bulimia is often binging and purging type behaviors.
So now you're using other language that we identified, right?
Okay, so often eating large quantities of food, feeling very out of control with food in that sense, and then using some compensatory behaviors such as vomiting, over-exercising to rid them.
Or using laxatives.
Or laxatives.
Does that fall into that category?
Absolutely.
But what's anorexia?
Anorexia is oftentimes under-eating or restrictive eating behaviors. That is then consequences of that is someone that's underweight, malnourished.
And finally, binge eating.
That is often overeating, again, excessive quantities of food, secretive eating, a lot of emotions surrounding that. But oftentimes no compensatory behavior, such as with bulimia. That is a big distinction there.
You know, Doctor, in getting ready for the show, one of the things that kept coming back to me, and Laura, I'm going to pull you in a moment, and we greatly appreciate you being with us and sharing your story, because I know you came for just one reason, to help other people.
Yeah.
Doctor, it kept coming back to me that our producers kept saying that you all said to them that eating disorders are not simply about food. And I'm thinking, of course it's about food.
No,
but it's not.
I think it's much more complex than that, you know, and most eating disorders have, you know, a psychiatric element to them, which could be mild or really severe. I mean, they may not always have a psychiatric component, but most of the time they do. And I think that's very important, like from my perspective, to try to pick up when you're seeing a patient in the office and to try to, you know, pull that out of a patient, because you know, patients aren't always coming because they, hi, I'm here, I'm anorexic, and I need help. they usually come sometimes with a complaint related to the anorexia or bulimia, such as constipation or something like that, and that they're not sure why they're constipated. Now, they may know that they're constipated related to the anorexia, but they also may be just feeling constipated and not realize that the anorexia is really a problem or something that they need to deal with. Do you know what I mean?
So, Lynn, not about food?
Not about food. Food is just the way that they try to cope by controlling the food. It's what's considered a maladaptive coping mechanism.
Go back.
So,
A
maladaptive,
coping.
which means something that's not good for you, and they're trying to cope. So we all have coping skills. Some
Don't
of them
we all?
some of them are positive, some of them are negative, and this is a negative one where they try to use the food and control it in a way to feel better about themselves, to maybe numb themselves out. Maybe they feel that there's other aspects in their life that they feel out of control. They feel if they can control the food, they're going to feel better. I mean, who hasn't had a compliment that they've heard if someone loses weight? You look great, you look wonderful.
What's wrong with that?
Nothing is wrong with that per se, but when it's used to cope with life, when it's used to feel better about yourself, and when it's used in an extreme way, then it becomes maladaptive. They want to feel better about themselves. So the food is just the component of what they can control.
Again, as you watch the program, if it's for you, if it's for someone you care about, and you want to get more information, use the websites that you see on the screen right now. Lynn, let me ask you. As Lynn was talking, she's referring to they.
Right.
But they is you.
Right.
How does that, your reaction to that?
I mean, I was in that position at one point, so.
What was your, as much as you want to share?
Right.
Or whatever you don't want to share?
Right. Well, I was diagnosed with anorexia. So.
How old were you?
I was 14. I'm 19 at the time, so it was several years ago. But Lynn referring to they, that's who I was at one point. And I mean, it took me a long time to be able to admit it and realize that I had something wrong and there was a problem. And especially when you're in that mindset, it's really hard to be able to see that there is a problem.
Let me ask you this, and again, answer what you choose to answer, and whatever you choose not to is fine. When do you believe your relationship with food started not to be as healthy as it could and should be?
I would say around age 10. I remember sneaking food up to my room, being very secretive. When my parents were out, I remember just taking candy out of the closet and overeating at that point in my life when I was younger. And it continued through high school when it went to the other side of the spectrum and I started restricting my intake.
Restricting your intake meaning?
Meaning cutting down excessively on the amount of food I was eating. So I was under eating, not eating nearly enough.
What was going on in your life that was not about food, that you weren't coping with? The maladaptive behavior, whatever you want to call it, but that you weren't adapting to.
Right. Well, from a young age, I didn't feel comfortable with my body. I was always comparing myself to others. And now, after going through treatment, I relate a lot of that to the relationships I had at the time with my family wasn't as close as it could have been. We were never an overly emotional family, like taught to express our emotions. And through treatment, that's changed. But at the time, that was really something that I struggled with, being able to be honest and close with my family.
Again, by the way, why did you come on the show?
I mean, whenever I get
in fact, we asked you.
Right. Whenever I get a chance, I just think it's really important to be able to help other people. And if I can help someone decide to go seek out help and treatment, I mean, that would be amazing because I know what it feels like and I want them to be able to get the help they need.
One more quick question on this. Do you believe a significant number of young people are struggling with this today?
Oh my goodness, absolutely. Yes, I see it every day.
You do?
Yeah. Oh, definitely being.
What do you see? Because I don't even know what
Right.
to look for. We have three young children, and
Right.
I'm sitting there saying, what
Right.
do we look for?
Well, what things I've noticed, especially being at college, is let's say I go out to eat with my friends, they'll say, oh, I'm not going to get that because that's too many calories, or that's so unhealthy, or, you know, always looking in the mirror, or constantly, I know people who constantly weigh themselves every day at school. So signs like that don't seem so big maybe in the moment, but definitely cause
I'm just
damage.
realizing something. Besides that, we had 3 young kids. I also have a son who's 22, turning 23. Age-wise, what's the, because I'm thinking, well, I don't have to worry about him. I just realized what I just said.
Yeah.
Yes.
Not true.
Not true at all. I mean, we've seen people in their 70s still struggling with this. So it really is across the board,
Yeah,
from very young age to very old age. I've had 3 generations in one family.
Do you think, okay, could it have something to do with someone's family?
Well, there's, sorry, I'm
No,
sorry.
I mean, there is this concordance with monozygotic twins with anorexic patients, where
What kind of
like
twins?
identical twins seem
Identical
to have
twins.
an increased rate, and first-degree relatives of
Right.
Anorexic patients seem to have an increased rate. So there's definitely, there is some familial element.
Okay, so take a step back. People watching right now saying, okay, what am I looking for? What should I be looking for? Let's be as specific as possible.
See, I think this is so hard because our culture is so diet obsessed, so it's very difficult to see, okay, where is this just someone dieting for health purposes, and then when does it cross over the line into something
Yeah, because I'm going to tell
very...
you, I'm sorry for interrupting. I'm going to tell you why this is perplexing. We did a show in the same studio a few hours ago talking about how each one of us has a responsibility to manage our health better than we do today. And a very top-level clinician said, oh, we need to stop telling our kids that it's cute. Oh, that a clinician confronting a parent saying, it's not that cute that you keep calling your kid chubby. It's not cute, it's a problem, and we need to deal with that, because if we don't deal with that, that child is going to grow up and have issues later on, health issues. Okay, I'm understanding that. Where do we go from that, Lynn, a healthy conversation, because there are issues of childhood obesity, to, hey, wait a minute, we've just crossed the Rubicon. Help me. Help all of us.
I think that it's important to understand, and I'm sure Ani can jump right in here too, is that all food is okay. There's no good foods or bad foods. It's just the amounts that a person, the quantity.
Is that true?
That a person
About food?
takes in.
It's quantity?
It's quantity.
It's quantity, and it's your relationship with that food. And I think, again, in our
relationship, it's food. You don't have a relationship
Absolutely,
with the food.
you have a relationship
Respectfully,
with
don't we have a
food.
relationship with people?
yes, and with ourselves, and with food, absolutely, and with physical
Like,
activity.
are you eating for stress or anxiety?
Right.
Are you,
Yes.
or are you not eating for stress and anxiety?
Right.
And I think you have to be very careful when you're talking to children about their weight, because you have to also understand, yes, there's the component of medical issues that could come down the line,
Yes.
but you also have to think about the psychological issues. You're damaging their self-esteem by bringing so much attention to how they look, and that's how they feel about themselves. So yes, it needs to be addressed, but you need to be very careful in how you address it.
But what is so perplexing to so many parents right now is that, I'm not going to say they, that we are trying to also figure out how to have honest conversations with our kids, not just about their health, but also, frankly, about how if they say they want to fit into certain clothes, and the clothes are not ridiculously those little skinny jeans that should be illegal. But like, I don't know what normal is, but they want to fit into certain clothes that are, and I'll say, listen, let's talk about what you're eating. Let's talk about how you want. What? That's a bad conversation? Help me.
My wife and I, my wife is a pediatrician. We have this conversation a lot about our 2 children. And, one of our children was putting on a little weight. And, we think the best thing is to say, you look healthy, as you are. Not that you're skinny or you're heavy. You look healthy. Once you start saying, you look great, that you're thin, or you look like you lost weight, that I think has the wrong connotation.
Really?
The focus should be, I think, on healthy,
We need your expertise too here. Help us.
Well, I mean, healthy is just a general term, it doesn't, if you put that connotation that, oh, you look so skinny or you look heavy, it's a strong label. Mm-hmm. So by doing that, it's affecting your self-esteem.
So hold on. Right. If a kid who is heavier does in fact start eating healthier, less of whatever, healthier choices, all the things we're promoting, Michelle Obama, she starts winning. We start getting healthier, eating better. And then a parent says to a kid, or someone around that kid says, you know what? You look terrific. Whatever you're doing, keep doing it. Unless I'm misinterpreting this conversation, that's not helping that kid. Or it's dangerous, potentially, with the wrong kid.
It can be.
I see a lot of head shaking.
It's not badly phrased, but
right.
Healthy would be better. Look like your health is better,
Right.
As opposed to the look.
Right.
The look.
Yes.
The look is the look. You look a certain way. That's the issue.
Right.
It can affect the self-esteem. Yes. That's what I'm saying is you have to look at the psychological aspects of this, because these children are building a sense of self and their self-esteem.
Safest thing to say is
you're looking more healthy. Do you feel better? Do you have more energy? Things like that.
Okay.
And take it away from the body image.
Cosmetic, less cosmetic.
Got
it.
Yes,
we're going to talk treatment in a moment. Go ahead.
I'm sorry, less about appearance and more, I think, about behaviors or the positive benefit that they're getting from nourishing themselves better, such as, wow, you have a lot more energy, or I notice that you're not as tired.
Which you will.
Absolutely. And focusing more on the behaviors and the positive versus, the positive aspects of that versus about appearance. Again, I think our society is so focused on appearance, overly focused on appearance, and you have to be careful with that, especially with...
And culturally, too. I mean, it's much higher in the Caucasian population, anorexia, than it is in the African American.
Right.
It's not like the media and the images we put out hurt the problem, right? We don't make it worse, do we?
Not you. Not you.
Not public television. We would, but in all seriousness, when you look, I was going to say, forget about magazines, just the internet, and some of the images put out as to what is perceived to be not just attractive, but the optimal look for young men and young women. It's not only not attainable, but it's scary. Were you aware of that to some significant degree?
Oh yeah, definitely. Like the media, not every person's eating disorder is affected as strongly by the media, but definitely for me, just comparing myself to other images and other people really affected me, because I tried to attain that, and I would look in the mirror and I didn't look like that, so I have to keep doing what I'm doing.
So that's interesting. Let's switch gears, because the breaking down the problem, we have 5 programs about that. The treatment piece, you said treatment helped, but most people don't know, I don't know exactly what that means. What did it mean for you?
For me, it was going inpatient at Robert Wood Johnson, Somerset, and I had a team of a psychiatrist, a therapist, and a nutritionist, all helping me. So I was in there. They really help you get to the root of the problem and look more into your behaviors, why you're acting out, rather
How
than.
long?
I was in for a month, inpatient. It's different for everyone.
You stayed there for a month?
Yeah.
You worked at it every day?
Yeah.
What do you believe you're working toward?
A life, a healthier life, a life where you're actually living and not out of control.
I mean, I think, I'm sorry to interrupt. There's something with the, the inpatient program that she was in is the point I want to make is that people die from anorexia. You know, it's not uncommon, and the inpatient program, you know, could have saved your life. You know, it's so serious, anorexia, that it's not just about.
When you say people could die from it, what is happening to one's inside? We'll come back to the treatment. What is happening? Not everyone's the same, but what could potentially be happening to one's organs?
Everything sort of atrophies, to be perfectly honest. Even the heart, you know, everything whittles away because it's protein that's being broken down to use for energy for the body.
Dehydrated?
Dehydrated, the heart muscle starts to go away. You could get heart failure, electrical disturbances. Sudden death is what I think, you know,
Kidneys.
anorexic patients should be warned about.
Kidneys
you know.
break.
Bone
loss.
Bone loss.
Bone loss, it can be lifelong too.
Talk more about treatment.
Treatment as far as the inpatient unit?
What really goes on?
With the inpatient unit, we kind of take them, patients that really need to be able to get control of their eating disorder, we kind of take them and place them in an inpatient setting, and it's like kind of putting them in this protective bubble that they can really just devote all of their time to working on how the eating disorder developed, what they need to change in their life, what do they really want control of, what do they need to kind of look at differently, and it really helps them get on course and being able to do that. Plus, there is the behavioral aspect, and the behavioral, as far as nutrition goes, we put them on a meal plan, the nutrition works with them in meal planning, and so it's a behavioral, a cognitive behavioral type of approach in the inpatient setting.
And someone says, I can tough it out, you say?
Well, it really depends on the severity.
Most people.
I think that most people that are deep into their eating disorders need to be in an inpatient setting.
I think most eating disorders are generally handled as an outpatient. You know, I mean, you know, anorexia, bulimia can be most of the times handled as an outpatient.
Yeah, again, it depends on the severity.
Right.
Yeah.
But it's got to be dealt with clinically.
Yes.
It's
And
got
close
to be.
follow-up.
Yes.
Close follow-up.
And the follow-up. Talk about the you said, what kind of program was it? Did you say again, Lynn? That you said the eating program afterwards, the setup?
Well, there's the inpatient setting, then there's a partial hospitalization setting, and then an intensive outpatient setting, and then outpatient team on the outside in the community.
But you're setting up the food. What'd you call it again? Because the food exchange program.
Yes, right. So
What does that mean?
Oftentimes, this is a very common meal planning system that's used in the treatment of eating disorders. It's a very highly structured meal planning system that.
Give us an example.
Example would be, you know, they would be on a certain calorie level with a certain number of exchanges based on each nutrient group. So, for example, breakfast maybe you need 2 starch portions or exchanges. You need either a protein or a dairy exchange, a fruit exchange, and a dietary fat exchange. It helps them to get the balance that they need in their diet and also help them get the calories and, of course, all the nourishment that they need. And it's a very structured way, but also helps them feel more in control of their eating, but in a healthier, more appropriate way.
Do you have
teaches them
such a
how
plan?
to eat again.
I did, yeah. When I was in the hospital, I got put on a meal plan using the exchanges.
How about today?
No.
What's it like today for you?
I mean, I eat intuitively, which is like what we as a society should strive to do. So it's like eating when you're hungry, stopping when you're full, you know, eating what you want to eat because
And you
how
just
you
finished
feel.
your first year of college?
Yeah.
And you're just away at college and doing your thing?
Yeah. Just.
And so I want to use the word recovery, but I don't know if I'm supposed to.
Yeah.
Yeah.
It's the appropriate word?
Right.
And are you, do you consider yourself always in recovery?
To be honest, I go back and forth. I feel like I will always, I mean, it's always going to be something I remember happening in my life. And I consider myself past it. I have trouble saying I'm in recovery or I'm recovered. I guess it's kind of still something that I'll decide on. But yeah.
Let me ask you, we have a minute left. What's the message you want to leave with everyone watching right now?
Well, definitely that eating disorders are a major, major problem in society, and they're not going to go away if people are not properly educated on the symptoms, what needs to be done so people can get treatment, and just that if you're struggling, even if you think it's a minor problem, just seek out a doctor or a therapist, someone that you can get help from.
Listen, we decided to do this program because we knew that there was a need. There are people who are struggling and suffering. Many of them are younger people, but also you made it clear that everyone at different ages struggling and suffering. And so that's why we had those websites, the Robert Wood Johnson website, the National Eating Disorder website as well. And I want to thank all of you for joining us and wish you nothing but the best.
Thank you.
Thank you.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the Robert Wood Johnson Foundation, Wells Fargo, Berkeley College, PSE&G, MD Advantage Insurance Company of New Jersey, the Mental Health Association in New Jersey, and by Steve and Elaine Pozicki. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
Think of 5 people in your life, including yourself. At least one is struggling with a mental health condition. And heroin and prescription drug overdoses are among the leading causes of accidental death in the United States. The Mental Health Association in New Jersey is a leader in advocacy, training, and services for behavioral health, including mental health and substance use disorders. The challenges are real, but recovery is possible.